think for myself as a radiologist, I'd like to be able to see a tool that was accessible on computers, on tablets, iPhones, with the patient there, or also when the patient isn't there, something that was universally accessible 24/7. I'd like to see it linked with, radiology is very much digital these days, so I'd like to be able to see a link with it, with the patient archive systems within the various NHS trusts, and within the radiology reporting systems, so that you have the images, you have the reports, and you have the digital patient all in one. I think for radiologists, we don't deal with patients quite as directly as some of the other clinicians might do, but particularly in my field, I'm a paediatric radiologist with an interest in skeletal dysplasias and child abuse, and particularly in the context of child abuse, I can see it being extremely useful in trying to understand whether a mechanism of injury would actually have caused the fracture that we've identified in a given child. At the moment, we're basing it on our experience. So if I say my child fell off the kitchen counter and didn't sustain a fracture, I use that sort of knowledge and the experience of other children and other trauma that they've been through to say, well, I'm not sure that this child in casualty today sustained that fracture through the mechanisms the parents are giving me. We could be wrong, which then means you're sort of subjecting them to accusations of abusing a child they love and have never abused, or you could be wrong and be discharging a child back to an abusive environment. So currently there's no way of actually knowing for sure whether a particular mechanism can cause a fracture or not. So to have a digital, a virtual patient to whom you could subject any sort of trauma ethically would be fantastic. I think really at the moment the virtual physiological patient seems to be working on the idea that life begins at 40. Actually it doesn't, does it, as we all know? I don't see any sort of address to fetuses, neonates, children, and that's going to be the major barrier, that people are developing this physiological human as an adult, and we can't actually necessarily apply, in fact we definitely can't apply some of those to the maturing skeleton. I think the main barriers will be this business of developing a digital model that encompasses the full entire age spectrum that we all go through. Well, you need experts on the panel who are paediatricians or paediatric radiologists who are dealing with children, so that children aren't overlooked, which I may be wrong, but my impression currently is that children have been overlooked. I think you have to think carefully about the legal aspects, not just within the context of child abuse, but generally, if you make a diagnosis or you decide that this is the likely outcome, and then the patient survives and that the outcome that you had predicted was wrong, there are going to be, you want to avoid being sued or the sort of legal complications that might arise from that. I think that needs to be seriously thought about. And I think there are also things to do with the intellectual property rights. Who does this human belong to? Who has access to it, when, how? I think you need to look into all that. Yes, certainly for me as a musculoskeletal radiologist, it would be particularly useful in other rheumatological conditions, allowing us to predict likely responses to treatment, complications of treatment, predicting final height for children who have short stature and skeletal dysplasias causing their short stature. We are currently trying to develop a new system of looking at hip joints, first of all, and then extending that to other joints, which would totally avoid the child having to have anaesthesia or sedation. So there are certainly other likely uses of the physiological patient. I think it would be a waste of resource if you constantly had to be updating this. You would be seen today, and Sheffield would have an avatar for you, and then you'd go to Great Ormond Street and they would have to design a brand new avatar for you. Each avatar might respond differently. I'm sure that it would be better if, as in, for instance, the hospital number, you could have that avatar linked to your hospital number, which follows your NHS number, rather not your hospital number. NHS hospital number is unique to each individual. And if you had your avatar linked to something like that, wherever you were within the UK, within the NHS, it would be that same avatar. I'm sure that would be a wise move. The plan is to move towards electronic health records, which once that is done and that's complete, then yes, the health records should be accessible anywhere in their entirety. But the complication at the moment is that they're not. Local notes are held locally, and you either have to phone up, you have to know that they exist elsewhere, and you have to try and phone up to get hold of them.